Hi everyone, welcome back to my channel. I don't know, it just feels weird doing my intro for this video because this is not the video that I thought I would be filming at this point. This is my 3-month post-op update for y'all. Yeah, I don't know. It's just like I'm coming to you with a very heavy heart. Honestly, I am not going to cry because I'm doing stuff after this, and I did, like, you know, I don't want to like ruin my hair and my makeup, you know. But I'm Tiana. Welcome back to my channel. I guess I've made a ton of videos regarding what happened to me with finding out I had a brain tumor, finding out I needed brain surgery. I did an update once I first got out of the hospital, and I was just so happy because I was truly doing so well, and I was so hopeful having that surgery that I wouldn't be in pain anymore, because that's what my neurologist had told me, is that the tumor was causing a pressure problem because it was in my sinus tract or whatever, sinus cavity. So I was so hopeful, and I was doing amazingly well, and then all of a sudden I developed some pretty severe complications that put me in the ER. I was in the ER on April 22nd, so about a month ago, but today is May 17th. This marks exactly 3 months post-op, so exactly today, because I had brain surgery on February 17th. And if you don't know about all that, I'll link the videos down below. But I had transsphenoidal brain surgery to remove a pituitary tumor. And the surgery was very successful. There was no real damage to my pituitary gland. I have full pituitary function. They just removed the tumor. And I no longer get pressure buildup headaches, but I developed a severe complication, and now I am just getting migraines. And they were so bad that they put me in the ER on April 22nd. And I'm not depressed by any means, but this is just a very depressing topic for me to talk about because I truly did not think that this was going to happen. But I do have some good news. When I went to the ER, well, first let me tell you, like, leading up what happened, why I went to the ER. So last month, by the way, the 22nd of April was a Friday. So I can give y'all exact dates and stuff. Basically, Tuesday, April 19th. Yeah, Tuesday evening, it was Tuesday, I was working at my internship. And I remember this because it really stuck out to me. But I got my first migraine, and I realized that it wasn't a pressure type of headache. It was just like the worst pain I had ever been in. Actually, I can't even say that. It was just, instead of a pressure headache, it was just like stabbing pain on the right side of my head. And it was where I used to get pressure buildup headaches, but instead of it being pressure related, it just felt like, I guess, lightning strikes in my head, and behind my eye hurt. I was crying out of one eye. I just like felt like I was going to die. I never get migraines with an aura. I don't get visual disturbances, but that's what happened. And I immediately took a sumatriptan, which is migraine medicine, and it went away. But I kept having to take sumatriptan every 5 hours because it lasts in your body for 5 hours. I kept having to take them every 5 hours until basically Friday the 22nd of April. And I was in the shower. I got a really bad migraine. I took a sumatriptan, but I was like, y'all, to my parents, I live at home, I was like, y'all, something's wrong. Something's really wrong. I need to go to the ER. And they were even talking about taking me to the ER. before I even mentioned that I was gonna go, like they were thinking about it because they knew something was wrong. I knew something was wrong. You're not supposed to have to take that many sumatriptan because you're not supposed to get continuous migraines back to back, but the pain was so unbearable. It honestly hurt more than when I was in the ICU after surgery. That's how bad the migraines were. And dealing with it at home while you're working and also in an MBA program, and I wasn't in the hospital, I just had to deal with the pain by myself, and I was taking so many, just like so much medication, and nothing was working. I used to be on topiramate, and it like stopped working for me. It's supposed to be a preventative migraine medication. It just stopped working. So I was having to take sumatriptan, which is like an abortive medication to stop a migraine once it already happens, because none of my preventative stuff was working anymore. And it was really scary. So I went to the ER. I went to St. David's on 38th Street downtown in Austin. They did not do anything for me. Like, the most beneficial thing that they ended up doing was giving me, they basically did an emergency MRI because they knew my history of having brain surgery, and then all of a sudden I'm in like excruciating pain. So they did that MRI, and my surgeon and the ER doctor, my brain surgeon and the ER doctor reviewed it with me, and they said, there's no bleeding, you healed up completely fine, your pituitary looks fine, there's no new tumor, you're just having migraines. So basically, I just got sent home from the ER with a hydrocodone Tylenol prescription, and I just had to deal with the pain at my house, basically, and it was so bad. And we were calling my neurologist, and I had to get like an emergency, like first available appointment. Basically, the good news is that everything in my brain healed fine. It's just now I'm getting these migraines. My neurologist said that they're probably hormonal migraines, and I think that might be possible too, because they started the week leading up to my period, and then I had migraines during the week of my period, so it's probably hormonal. But even my neurologist said, you know, a lot of people who have brain surgery develop migraines as a complication. And I asked him, how long do we think it's gonna last? He said, it's hard to say, I don't know, but we just need to break the cycle of the migraines that you're having now, because even in his office, I was not doing well. Usually he'll like shine a light in my eyes just to look back there, because he's supposed to be able to see stuff. And I was like, you know, I can't do that today. Like, I am not doing well. And my head was so sore on the right side, because when you get that many migraines, it hurts and you have soreness. It's like my brain was sore, and I was dealing with this and working. And I was also, it was like finals week for school. I was working on a final project, and I had to deal with this, and this is the most pain that I've ever been in. And it made me very, like, it made me so sad, because I just thought after brain surgery I was gonna heal and be fine and not have to worry about this kind of stuff anymore. And I'm clearly not fine. Like, I have the medication and a team of doctors to work with and everything I need. I'm so lucky that I'm blessed enough to have parents with good jobs who have insurance and make enough money to just pay for all my medical expenses and bills and make sure that I can get the proper medication. Like, I am so thankful, but it's honestly depressing, because I had so much hope that after I got the brain surgery I was gonna be back to normal. Thought I was gonna be back to normal Tiana. You know, the vlogs that I used to post in college with my friends, just having so much fun. I thought I was gonna be her again, and I'm not. I'm still sick, and it's just different now, and I don't know when it's gonna stop. So it's just, this is the hardest video I've ever had to film. I really thought I wasn't gonna cry, but anyway, I also wanted to like kind of be informative in this video in case anyone else is having brain surgery complications, because a lot of people have been commenting and reaching out on my other videos saying that they are getting the same surgery as me, and it was really helpful to see my video and everything and how I recovered. And I did recover. I recovered so well. I was fully back to normal in 6 weeks. I started going on runs, lifting weights. I, for the most part, am still a pretty active person. I live an active lifestyle. I'm still lifting weights every day. But I am scared, you guys. I'm scared to go on runs. And y'all know I love running. I'm scared to do that because I don't know if I'm going to get a migraine. I haven't really been taking spin classes. And it's just hard to live with this because I have gotten migraines while I'm driving, and it's just like so scary. I've gotten them just being out and about, and I'm constantly always having to carry around like my medicine and stuff. I just always make sure I have it with me so that if I do get a migraine, I can take it immediately. And for the most part, I am living a normal life. It's just like not what I had imagined because I'm dealing with basically chronic pain. I'm perfectly healthy though. My doctors all made sure to tell me that I'm perfectly healthy. I've been to the endocrinologist. I spoke with my neurosurgeon. I've been to the neurologist. And I have definitely had to call and ask him questions and like ask for medication and stuff. And everyone has made sure to tell me that I'm perfectly healthy. But now I'm just dealing with migraines, and that is an issue that affects a large portion of the population. Like a lot of people do get migraines. There's a lot of different ways to deal with that pain and medications, and it's just a matter of finding what's going to work for me. But I guess now I can be informative and tell you guys all the shit they prescribed me, because I am telling you right now, I think I would have I don't think I would have made it to this point if not for the doctors and the medications. But I'll just go ahead and tell you everything because I always do that. I always like to be informative for y'all. But I started taking my birth control again. My birth control did not cause my brain tumor. It did not. Every doctor has told me that, but I'm basically just taking like a low dose birth control because I felt like going back on it would possibly regulate my hormones, might help. This is my first month back on it. I'm still getting the migraines though, so I don't know. This is probably something that will work over time. I might have to continuously take it. But to break my migraine cycle, my neurologist prescribed dexamethasone, and he gave me 8 of them. I was on this for 4 days, so you take 1 pill at 8 a.m. and 1 pill at noon. I think it helped. Instead of topiramate, since that stopped working for me, he gave me carbamazepine, 200 milligrams. This is another anti-seizure drug that's also used to treat migraines. And I just take one at 9 a.m., 1 at 9 p.m. Nothing too crazy. It made me really nauseous. Not really nauseous, I never threw up. It just made my stomach uneasy and I wasn't really wanting to eat, but that's also probably due to a lot of factors. The dexamethasone also can irritate and upset your stomach, so he had me take this with an anti-acid tablet. I think the carbamazepine is working though, but my head was hurting pretty bad yesterday, and I did have to take sumatriptan, and I think it's because yesterday, like, I'm on week 3 of the birth control pills before you get your period. I don't know if that coincides with anything. I don't know, but yeah, my head was hurting. And then he gave me sumatriptan as an injection, so I've only had to use 1. He gave me 4 because I remember this night, this was the worst shit I've ever dealt with. My mom thinks it's because I ate chocolate, but I'm kind of realizing I can't have chocolate and I can't have wine probably. But I got literally the worst migraine I've ever had, like the worst pain imaginable on the right side of my head. I was literally in bed and I was just like screaming, like it's never been that bad. So I injected myself with the sumatriptan. I'll show y'all what it looks like. And it works, it does work, but if you have taken sumatriptan as a pill, you can't mix the two. So in 24 hours, if I've taken a sumatriptan pill, I can't inject myself with this. But it's just a needle. It looks like an EpiPen. You just like put it on your leg and then press the button. And it does work a lot faster than the pill sumatriptan, because obviously like your body has to break it down, whereas this is just an injection. So he gave me that. And then today I took a frovatriptan tablet, which is basically a longer acting sumatriptan. It's supposed to last in your body for 24 hours instead of just 5, because I woke up with a headache and I was like, you know what, I have work today, I have a lot of stuff to do. So I'm just gonna go ahead and try this out. I've only taken it once, but my head doesn't hurt as bad. Yeah, and then of course sumatriptan 100 milligram tablets. I used to be able to get by with just 50 milligrams, but I can't. 50 milligrams doesn't work for me anymore. So now I have to take 100 milligrams. And he said don't exceed 200 milligrams of sumatriptan in a day. And also, since I took frovatriptan today, I can't take any sumatriptan because you can't mix them. Like you can't mix some of the stuff. So it's just like a lot of stuff to remember, a lot of stuff to take. It's just crazy because from the outside you'd never know that I was struggling with all this, because I don't look like someone who had a brain surgery. I look healthy. Like I go to the gym every day pretty much. I have abs. Like y'all see me on Instagram, but that person is me, but this is also me like sad and crying because I don't know what's happening and I don't know when it's gonna stop, and I don't know really what else to do other than just try to stay positive. But let me tell y'all, like it's hard to wake up every day and work and do school, and it's just hard sometimes, but life doesn't stop and I'm healthy. I just have chronic pain now, basically. I'm obviously not where I thought I would be at 3 months post-op, so I did just want to make an update because I'm sure some of y'all are curious. And that's also why I haven't been posting on YouTube, is because I've been dealing with all of this. So thank you to all my subscribers that are still here and still care to watch. But yeah, that's about it. I'm just gonna go ahead and edit and post this. But this was my 3-month post-op update. Hopefully in 6 months things will be a lot better. And I plan to do, so this was 3 months, 6 months, and then a year. So we'll see how this whole series ages, but hopefully it gets better, because I don't know how much longer I can deal with all this. And I'm just gonna go ahead and end the video.